welcome to the deep dive. Look, it sounds like you're in a tough spot right now, heading into hospital urgently for what doctors call acute deep vein thrombosis.
Yeah, a blood clot in a deep vein. It's definitely a lot to process, especially when it happens suddenly.
Absolutely. And we
Yeah.
get that you want to feel more informed, maybe a bit less in the dark about what's going on based on the information you've shared with us.
For sure. So what we want to do here is kind of walk through those documents with you. Think of this as us trying to map out what the sources say you might expect.
A roadmap, yeah, drawn from these expert materials just to give you a clear picture.
Exactly.
So maybe let's start with the basics from your sources. What exactly is this thing, acute deep vein thrombosis, or DVT?
Right. So one source puts it pretty simply. It's basically a blood clot that's formed recently, generally within the last couple of weeks or so.
And it's in a deep vein. What does that mean, practically speaking?
Good question. These deep veins, they run alongside your arteries, deeper inside your body, like within the muscles of your leg or sometimes your arm.
Ah, okay, so not the ones you can easily see just under the skin.
No, these are further in. They're doing the important job of carrying blood back towards your heart.
Got it. And when a clot forms there, it messes with that flow, right?
Precisely. And that
Yeah.
disruption, that blockage, is often what causes the symptoms you might be feeling. You know, the swelling, pain, maybe warmth in that limb.
Okay, that makes sense. So we know what it is. Let's build that roadmap for the hospital admission.
Yeah.
What did these sources say to expect right when you get there?
Well, the first really critical step, according to these documents, is nailing the diagnosis. They need to be sure it is an acute DVT.
And how do they do that quickly? The sources mentioned testing.
Yeah, they point to non-invasive tests, specifically something called vascular ultrasonography. You might hear it called a duplex ultrasound.
Ultrasound, okay. Like for pregnancies.
Similar technology, using sound waves, yeah. But the duplex part is key here. It doesn't just create a picture. It also checks how the blood is flowing through the veins.
Ah, so they can actually see the clot and see if blood is getting blocked or slowed down.
Exactly that. It lets them visualize the vein, pinpoint the clot, see how bad the blockage is, and it's, relatively quick and painless, crucial for confirming things.
Okay, diagnosis confirmed with ultrasound. What's next, according to the sources? Like, immediately.
Treatment usually starts right away. We're very close to it. The priority mentioned is starting medication to thin your blood, anticoagulation.
Thin the blood straight off.
Yes. The sources suggest this might initially be an injection under the skin. They call it subcutaneous, something like heparin, perhaps, to get the medicine working fast.
Okay. Arrive, ultrasound confirms, start blood thinner, maybe an injection first. That kind of covers the immediate arrival. What about the actual hospital stay? What's the main game plan then?
So the big focus during your hospital stay, and really for the first phase of treatment, maybe up to 3 months, is that anticoagulation, thinning the blood.
And why is that the main focus? What's the goal?
Well, the sources lay out a couple of main goals. First, stop the clot you have from getting any bigger.
Okay.
And second, maybe even more importantly, reduce the risk of a piece of that clot breaking off.
Because if a piece breaks off,
That's the really dangerous bit. It can travel through your bloodstream up to your lungs and cause what's called a pulmonary embolism.
right, I've heard of that. That's serious.
Very serious, potentially life-threatening.
Yeah.
The sources definitely link it to DVT and stress that preventing it is a major reason for the anticoagulation treatment.
Okay, so blood thinners are vital. Stop the clot growing, stop it traveling to the lungs. Now, these documents you shared, they seem to have some strong opinions on which blood thinners are best now, don't they?
They really do. This is a very clear point in the guidelines discussed in your sources. For DVT in the leg, which is most common, they strongly recommend a newer class of drugs.
Newer drugs.
Yeah, they're called direct oral anticoagulants, or DOACs for short. The guidelines say these are generally preferred over older drugs like warfarin. Warfarin is a type of vitamin K antagonist.
So they're really pushing these DOACs. Why is that?
Well, the preference is based on a lot of research, multiple studies, and expert agreement mentioned in the sources. They often point to advantages like they're pills you take by mouth, which is simpler,
Okay.
and their effect tends to be more predictable than warfarin, which often needs regular blood tests to check the levels and adjustments based on diet.
Ah, I see. So less hassle, maybe.
Yeah.
And the sources actually name some of these DOACs.
Yes, they mention specific ones like apixaban, dabigatran, adoxaban, and rivaroxaban. These are the kinds of oral meds often favored now for that initial treatment phase for leg DVT.
And warfarin. When would that come into play?
The sources suggest warfarin or other vitamin K antagonists would generally only be the choice if there's a specific reason why you couldn't take one of the DOACs, maybe another medical condition or interaction.
Gotcha. So hospital stay, eat blood thinners. Probably one of these newer pills based on the evidence in these papers. That seems clear. What about when you get discharged, going home?
Right, so the blood thinner treatment doesn't stop when you leave the hospital. It definitely continues. But how long it continues is a really important question.
So the duration varies.
Big time. And the sources say it depends heavily on why you got the DVT in the first place, what triggered it, or if there was a trigger.
Okay, explain that difference.
So if the clot just seemed to happen out of the blue, what doctors might call unprovoked, or if it's related to an ongoing risk factor you have, something persistent.
Like another health condition.
Exactly. Then the sources recommend what's called extended phase anticoagulation, basically staying on the blood thinner for longer.
Longer meaning potentially for good.
It could be, yeah, or at least for a much longer period. The aim then, usually still with a DOAC, is to really cut down your risk of getting another clot later on. That risk is higher in these unprovoked cases.
Okay, that makes sense. Longer treatment if the risk is ongoing.
Yeah.
What if the clot was clearly linked to something temporary?
Right. So if your DVT happened because of, say, a recent surgery you've now recovered from, or maybe you were laid up for a bit with an illness but you're mobile again, and that temporary risk factor is gone, then the sources suggest extended anticoagulation might not be needed. Treatment might be shorter, often around that 3-month mark, because the thing that likely caused the clot isn't there anymore.
Okay, tailoring the treatment length makes a lot of sense.
Yeah.
Now, what else is important after discharge according to these sources? Especially thinking long-term.
Another really key thing, mentioned quite a bit across the documents, is compression therapy.
The stockings. I was wondering about those.
Exactly. Usually elastic compression stockings, sometimes other types of compression bandages, maybe at first. And the sources are pretty clear. They suggest wearing these often at a specific pressure level.
Pressure level.
Yeah, they mention a range like 30 to 40 millimeters of mercury, and wearing them for quite a while.
How long is quite a while?
At least 2 years is what's recommended in one of the key sources, and there's a solid reason behind that length of time.
Okay, what's the thinking there?
The evidence discussed suggests that consistent use for that period, like 2 years, can actually help lower your chances of developing a long-term problem called post-thrombotic syndrome.
Post-thrombotic syndrome.
Yeah.
Okay. Sounds like something that happens after the clot.
It is, yeah. We can touch on that more. But even besides preventing that, the sources say compression also helps right now with managing symptoms you might still have, like leftover pain or swelling. Swelling is also called edema.
So the stockings aren't just for comfort. They're actually therapeutic, both for symptoms now and potentially heading off future problems.
That's exactly the takeaway from these sources. They frame it as a really fundamental part of managing things after a DVT, both short and long term.
Okay, fundamental. Good to know. Now, thinking about potential problems, what about warning signs? What should you be aware of based on these materials?
Well, the sources are mainly clinical guidelines, but the biggest risk they consistently highlight because you're on blood thinners is bleeding.
Makes sense. Thin blood means more risk of bleeding.
Exactly. All anticoagulants carry this risk. It could be minor things like bruising more easily or nosebleeds, or it could be more serious. The sources don't list every single patient's symptom, but the implication is clear.
Be aware of bleeding.
Yes. Be vigilant. Know what signs your medical team tells you to look out for, like unusual bruises, bleeding gums, blood where it shouldn't be, and know when to get help if it happens.
Okay. And you mentioned pulmonary embolism earlier, the clot traveling to the lungs. That's another major risk to understand.
Absolutely. While the sources don't detail the specific warning signs for patients of a PE, they definitely position it as a serious, potentially fatal complication of DVT. It really underlines why treating the DVT promptly with anticoagulants is so critical.
Right, highlights the seriousness of the whole situation. Okay, so be mindful of bleeding from the meds and understand the PE risk. Let's circle back to that long-term thing you mentioned, post-thrombotic syndrome. That's related to chronic vein issues.
Correct. Sometimes, even after the clot itself is treated, the DVT can cause lasting damage to the vein wall or the little valves inside the vein.
Valves, like one-way doors for blood flow.
Exactly. And if they get damaged, they might not close properly, letting blood flow backward. That's called reflux. Or the vein might stay narrowed or partly blocked where the clot was. That's obstruction.
And that causes ongoing problems.
It can, yeah. Things like chronic leg pain, persistent swelling, skin changes like discoloration or hardening, and in severe cases, even ulcers on the skin. This whole cluster of long-term issues after a DVT is often called post-thrombotic syndrome, or it falls under the umbrella of chronic venous disease.
And if that happens, how do the sources say it's managed?
Well, the sources reiterate that non-invasive conservative approaches are usually the first line. And guess what's front and center again?
Let me guess. Compression therapy.
You got it. Compression remains the absolute cornerstone, the foundation for managing the symptoms of chronic venous disease or post-thrombotic syndrome.
So those stockings might be a long-term companion, not just for the first couple of years, but for managing symptoms if these chronic issues develop.
That's right. They provide essential support, help with the blood flow that's been compromised, and can significantly reduce that chronic swelling and aching that comes with damaged veins. The sources really emphasize their long-term role.
Wow. Okay, this deep dive, using your source materials, has really laid out a path, hasn't it? From the initial diagnosis, the urgent start on blood thinners.
Understanding that the type of thinner, often these DOACs, and how long you take it for really depends on your specific situation.
And the crucial role of compression, both early on and potentially much longer term.
Yeah, we've seen how these documents really guide the medical thinking at each step. Hopefully, having this overview based on those sources gives you a better foundation as you go through this.
So when you pull back and look at all this information from the sources, what's the bigger picture? It really shows how complex this whole clotting system is, doesn't it? And how treatments are always evolving.
Absolutely. And it strikes me that managing something like DVT isn't just about the doctors doing things to you. It's also about you understanding what's happening, why these treatments are used.
Like the blood thinners, the compression,
Yeah,
and how your body is responding.
exactly. Thinking about this journey from the urgent start to potential long-term management, it really highlights how understanding your condition makes you a partner in your own care.
An active participant. That's a really empowering thought, especially now.
Definitely.
Well, we really hope walking through these sources has helped make things a bit clearer and feel a little less overwhelming. Thanks for joining us for this deep dive.